I think the thing that surprised me most about the nursing program was how hard it was at first.
I never had to study harder in my life. I was never somebody who had much difficulty in school, so coming into the nursing program, it changed my whole perspective on what it really means to work hard and be a student and gain in the field experience.
Even though it's a challenging program, we want to be educated, qualified nurses when we're getting out there in the workforce. So I think that having instructors who are looking to help us succeed, who are looking to really teach us on a variety of levels, not just the knowledge, but also how to be good humans, I think you really get that here at SUNY Delhi.
The art of nursing is to take care of your patient physically, to identify when medically things may not be going well, but it is an art. Nursing is an art that we carry out other activities, such as recognizing when our patients are in distress. We recognize when they need more than a blood pressure, but maybe a hand to be held. And we try to emphasize that with our students.
Our lab is definitely one of our best hands-on resources we have. Every time you learn something in class, you could guarantee that you're using it in clinicals. There's so many skills that you have to practice, whether it's something as simple as putting in a catheter or medication administration. So being there and having the instructors to guide you and walk you through what it is you need to do step by step, very important.
Because then when you get into clinical and you're performing those skills, there's like little room for mistakes because you've practiced it over and over.
That's a little better. All right, so why is it important to put the head up like this?
There's so much information that as nurses we can learn that it's going to make us better nurses. And we can already see it in the faculty that they have this knowledge, they've internalized it, they've used it, and then they have the experience on top of that.
I love challenging them to come up with my next sentence. What is the next action a nurse would take? And I love seeing them come up with that. We laugh a lot, we challenge one another, and then I get the opportunity to bring them to the clinical setting, and that's like magic. That is amazing to be with them and seeing them carry on the things we talk about in the classroom.
So before we give antibiotics, what do we want to know about our patient's history?
SUNY Delhi's reputation in the nursing field is actually one of the biggest reasons why I chose to come here.
A lot of the graduates, they pass their NCLEX on their first attempt, which I think is really important because it shows that the teachers are doing a good job and so is the program overall.
There's a lot of skills that I learned just in my first semester that I feel like I'm gonna bring with me throughout the rest of my life for sure. Critical thinking, mindfulness, therapeutically talking to somebody. I grew up watching my mom, she was a nurse, and I felt like I was capable of it. Now I can't see myself doing anything else.
It's motivating me to want to be that kind of human that other people want in their lives, the kind of nurse that someone wants to take care of them, the kind of nurse that makes an impact. So I would say SUNY Delhi is helping just increase my motivation to really be the kind of nurse that I would want taking care of me or taking care of my loved ones.